Stomach 32 is located 6 and superior to the superior border of the patella on a line joining the lateral border of the patella to the anterior superior iliac spine. If you divide the distance between the superior aspect of the patella and the prominence of the greater trochanter into 3 equal parts, this point will lie just a little more proximal than the lower third. Gallbladder 41 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 4th and 5th metatarsals. If you articulate the 2 metatarsals, you'll be able to feel a nice groove in between their shafts. Gallbladder 41 is located lateral to the tendon of extensor digitorum longus, little toe branch. If you extend the toe, this will bring this tendon into relief. Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Small intestine 2 is on the ulnar aspect of the little finger in a flare just distal to the base of the proximal phalange in here. Large intestine 8 is located 8 cm proximal from large intestine 5 going towards large intestine 11. Palpate for a nice groove in the muscle. Small intestine 3 is on the ulnar aspect of the hand. It's in a depression which is proximal to the head of the 5th metacarpal. It's in between the metacarpal bone and the muscle, and it typically lays on a level with a distal palmar crease.
Large intestine 5 in the anatomical snuff box. I'm going to ask Laurie to extend his thumb under resistance, and that brings the snuff box into relief. And just relax. I'm going to articulate the wrist to find the deepest part of the hollow now it's relaxed. And I'm going to put my point in, which is in between the 2 tendons of extensor pollicis longus and brevis.
Do 16 is located on the posterior midline at the base of the occiput. To find the base of the occiput, palpate down to about 1 cm superior to the posterior hairline. If you rock the head backwards and forwards very gently, you should be able to feel the cleft between the base of the occiput and the spine. Make sure you mark this point directly on the posterior midline. Gallbladder 12 is found just a few fen anterior and inferior to the extra point peaceful sleep. To locate stomach 6, palpate the posterior and inferior border of the mandible to find the angle of the mandible where the jaw is changing direction. come 1 finger breadth superior and anterior to the angle of the mandible. When the person clenches their jaw, the masseter muscle comes up. When they relax, your finger will fall into the nice dip that is stomach 6. To locate Sanjiao 20, press the ear against the side of the head. The point lies directly superior to the apex of the ear on the side of the head. When a person opens their jaw, a groove forms anterior to the tragus. Palpate in this groove and locate Sanjiao 21 in this groove anterior to the supratragic notch. When a person opens their jaw, a groove opens up anterior to the tragus. Gallbladder 2 is located in this groove anterior to the infratragic notch. Gallbladder 3 is located directly above stomach 7. Palpate over the zygomatic arch and feel for a nice dip just above its superior border. Small intestine 10 is located on the posterior aspect of the shoulder. It's directly superior to the posterior axillary crease and inferior to the lateral extremity of the spine of the scapula. Find small intestine 9, come straight up, feel for the spine of the scapula, and then come back down into a nice dip to find this point. You're not on the bone and you're not on the deltoid, you're in a nice dip. It's important to remember that to find this point accurately, you need to be standing parallel to the part of the body that you're working on. Small intestine 11 is found at the junction of the upper third and lower 2/3 of a line joining the midpoint of the inferior border of the spine of the scapula and the inferior angle of the scapula. It roughly makes an equilateral triangle with small intestine 9 and small intestine 10, but this is not always accurate. To find small intestine 11 accurately, you first need to identify all of these landmarks. To find the medial border of the spine of the scapula, place your hand on the back where you think the medial border might be. If it's not palpable, a slight amount of pressure on the shoulder will help to bring the medial aspect of the scapula into relief. To find the lateral extremity of the spine of the scapula, palpate along the spine until you find a bump at its end. Be careful not to go completely to the end of the shoulder. This is the end of the acromion process. It's not the end of the spine of the scapula. To find the inferior angle of the scapula, palpate down the medial border until you can find the scapula changing direction at its bottom. Once again, if this is not palpable, it may help for the person to put their arm behind their back. This will bring the angle, the inferior angle of the scapula, into relief. It's important to remember that once you've located it, you need to keep your finger on it as the person moves their hand back.